We are with House Speaker Mike Turzai from the North Hills. Speaker Turzai, always a pleasure to be with you. Thank you, sir.
John, thanks for having me.
Let me ask you about a concern that you've raised about whether schools in Pennsylvania will be opening this fall. Can you specifically tell us what is your concern?
Yes, Secretary Rivera, I want to quote this, said we would likely not reopen in the fall would not reopen schools in the fall. And to me, that's outrageous. We want to know, he's going to have nearly 6 months. What is his plan to return our students safely back to the classrooms by Labor Day? His attitude is a can't-do attitude. It needs to be a can-do attitude, and we have to open the schools safely by Labor Day, period.
Is that possible? I know there are a number of folks.
It's definitely possible. And we need to use common sense and safe practices. And as you know, John, the risk population is seniors with comorbidities and primarily those in nursing homes or personal care homes. Allegheny County, John, let's just take a look at Allegheny County. We have 1,218,000 citizens in our county. We've had, unfortunately, 99 deaths. That's 0.008% of our county's population has passed attributable to COVID-19. The reports have made clear, and listen, we weren't getting this data until we pressed, and we're still not getting all of our data from the Secretary of Health. But almost 80% of these were seniors in nursing homes and personal care homes. And then this quote from UPMC, Dr. Donald Yealy, the UPMC's chair of emergency medicine. We've learned that way more people, far more people have actually been exposed without any knowledge of it. And that makes the overall death rate much lower. Many people just don't feel sick at all and recover without difficulty. And he said the majority of the deaths are UPMC patients involved over 80 years of age, and with many being nursing home residents. In Allegheny County, UPMC is our largest employer, and they have hospitals all over the state, 40 of them, 5,522 beds. Less than 2% of those beds have COVID patients.
So let me ask you, though, coming back to the schools, I mean, you're basically pointing out that it's young people are not the most susceptible to COVID-19. How do you envision our schools reopening in the fall? Will they be different than what we've experienced in past years?
I believe that the Secretary has a job to do. We spend $33 billion on public education, K through 12. Every teacher, administrator, staff person is being paid. All benefits are covered. When you're in charge of that kind of a system, you need a plan. You're the Secretary of Education. You should be talking to superintendents all across the state. And for each district, there ought to be a plan that provides for a safe return to schools. You know, John, many of the schools now already have to deal in terms of risk management. Kids come in with previous viruses or flus or hand, foot, and mouth disease, in certain occasions, lice. We have to have common sense approaches to how we keep everybody safe. There's a variety of ways to do it. Stagger start times, determine what your numbers in your classrooms are going to be. Make sure that you bring lunches into the classrooms with safe distancing. Make sure teachers, get fever testing before they come into the school. There's a wide variety of common sense hand sanitizers throughout the school buildings. This can be done in a very safe and common sense manner, and we need to get the students back to school because the risks to those kids in not being able to get educated and to be able to pursue their dreams. I want to use this quote. All kids have dreams. This is from my letter to the Secretary. No matter their special needs, backgrounds, race, gender, age, or zip code. They work hard, they want to succeed, they enjoy playing instruments in real concerts and recitals, they want to act and sing in musicals, they want to build and construct, they want to weld, learn about engines hands-on, show animals in 4-H contests, compete in Skills USA competitions, do lab experiments, run track, throw javelin, play baseball and softball, row, swim, and with innovation and common sense, John, all of these activities can be done safely. And right now, the secretary's rash judgments and statements, instead of providing direction and hope, he's the Secretary of Education. He has fostered depression, anxiety, and hopelessness. Parents, students, teachers need to know that we are going back to school by Labor Day. And for those students that do have risks, medical risks, there has to be an individual plan for each of those students. And if the school district has to provide a tutor separately, we understand that. They have to take into account each of those students that have those particular risks.
Can you reopen schools and still have social distancing? Or are you assuming that by this fall, we won't need to do social distancing?
Everybody has moved to a new normal, John. It can be done. He has more than 6 months, through Labor Day to get this done, get it done.
Speaker Turzai, let me ask you about the governor's declaration that this southwest part of Pennsylvania is not going to be in the first area, among the first areas that will move to the yellow coded zone, I guess you could call it.
Yes.
Did the governor make a mistake?
Oh, without a doubt. First of all, look, we're operating within the schema that he's put together. I have questions with the schematic, but using his schematic, Allegheny County clearly fits, as do the counties in southwestern Pennsylvania. Now I'm using his measurables, John. He said if you are over the 14-day period, if you are under 50% or 50 new cases per day, then you should be able to move into this yellow zone. I think the yellow zone is still too restrictive in terms of, because you can have safe practices following Center for Disease Control guidelines. Nobody is saying that you need to have bars open or restaurants open with crowded venues. Nobody's saying going to, arenas to crowd around each other. We're talking about safe distancing, social distancing practices. While we can have economic activity. Allegheny County averaged 26.5 over the last 14 days. And the other thing that I just think is key, John, is the statistic that the vast majority of the issues are coming out of nursing homes. And we have more than enough hospital beds in Allegheny County, more than enough hospital beds. We actually have significantly good healthcare provision in Allegheny County and southwestern Pennsylvania. So that's not the issue. Really, Allegheny County should clearly be in the yellow, as should the rest of the Southwest.
Do you have any expectation that it's going to be included in the next round? Have you been told anything?
I would just say this. I think that the schematic has to be revisited. The criteria have been met, and it's arbitrary and capricious that Allegheny County and the Southwest has not moved into that yellow zone.
Final question, Mr. Speaker. Let me ask you about your colleague, Representative Frank Ryan, a fellow Republican. He's introduced a bill that would essentially mandate a pay freeze for public officials in 2021. What's your view of this measure?
I'm decidedly in favor of it. 1.7 million of our fellow citizens have filed for unemployment compensation in the Commonwealth of Pennsylvania. Another 130,000 have filed for the pandemic unemployment assistance, and those tend to be sole proprietors, where they, have their own business for themselves. We're fast approaching 2 million of our fellow citizens, well over a quarter of our workforce. And when you see doctors and nurses and healthcare professionals being laid off across the Commonwealth of Pennsylvania, and folks from all walks of life, small business folks like florists or bike shop owners who maybe had 4 to 6 weeks of savings, people are hurting. And here's the key. People are seeing higher incidents of domestic violence in our local communities, alcoholism, drug addiction, depression. We need to turn the economy around for this, because it is going to outweigh what our risks are from COVID. And we have to share in that pain. So we've already had a hiring freeze. We've already had a pay freeze. Legislators have to take on a pay freeze as well, and there may even be reductions. we're going to find a way through attrition to reduce our staff components. And everybody has to tighten their belts and do what's best. Now, we do know that for public education, everybody's being paid and everybody's receiving benefits, and we're all still paying taxes, which is why we must get our children back to school by Labor Day. I think that we're missing measurables for what's happening right now during this shutdown period. Are students really learning? Are the parents doing the teaching? Are they really homeschooling? Are they getting much out of the educational establishment? We haven't heard anything from Secretary Rivera, but I would say that students all across Pennsylvania are seeing a shortfall in meaningful education.
Just to be clear, did you say there's already a pay freeze in effect in the state legislature?
Yeah, we instituted it for the House, a pay freeze and a hiring freeze. We are looking at reductions from attrition. That's going to be our first step. And I absolutely support a pay freeze for legislators, for everybody who serves. We have to tighten our belts just like everybody else is going to tighten their belts.
Will that legislation then be up for a vote shortly?
Yes.
Well,
I have to say, my good friend, I call him, he is my colleague, State Representative Frank Ryan. I call him Colonel sometimes. As you may know, he was a Marine Colonel. And he's also a CPA, a certified public accountant.
And it sounds to me like you won't say no to the Colonel.
He and I have a really good friendship. He and I think very similarly.
Well, House Speaker Mike Turzai, always a pleasure to talk to you. Thank you, sir, for giving me the time this morning.
John, thanks for having me.